My name is Christian Jacobus. I'm the medical director for Bridge Hospice. So hospice aims to be all-inclusive medical care for people who are in their last 6 months or so of life. We provide medical care in-home, so nursing care, aid services. We provide social work and spiritual support as well. Bereavement services for after the patient has died. Medical director services, so we provide all medical equipment that a patient needs and any medications that are related to comfort. You know, our goal is to improve their quality of life. And so we do that medically, but also socially, psychologically, and spiritually as well. Just trying to wrap people around with as much support as we can.
I lost my late husband 3.5 years ago. Ron's journey was a quick journey. He was diagnosed with stage 4 cancer here at Blanchard Valley Hospital. He utilized the services of hospice, and he was a believer that hospice and the nurses and doctors of this foundation were the heroes of this community.
My mom, Mary Margaret Stolley, had some issues with her lungs. The cardiologist had mentioned, we might want to call in hospice. The first thing I thought of course, was Bridge Hospice, because we had such phenomenal care with my mother-in-law. And I knew they weren't here local, but as soon as I called right away, they said sure, and they came to Lima, and we couldn't ask for anything better.
The majority of our patients are at home or in a nursing facility as outpatients, and the majority of them stay there. We're pretty good at managing people's comfort right up to the very end with them out of the hospital.
Mom always wanted to be home.
And I knew that's what she wanted, and we weren't going to do anything else.
To be able to have the choice of being at home in this very critical time, I thought makes all the difference in the world.
Being part of the Blanchard Valley Health System does allow us to have much easier communication with other physicians who are part of the health system. So being part of the same healthcare system and having such ready access to them really helps me keep patients' medical plans clear and up to date and keep everybody on the same page.
The nurses and the doctors communicated at a top-notch level. They just have an empathy and communicated in a way that made us understand and felt comfortable with the experience that we were going through.
Bereavement is one of the less talked about features of hospice, but it is a core part of the benefit.
When Ron passed, they allowed us to have as much time as we needed. And it was almost like they were taking care of us at that point. And to me, that was very important.
When you think back on the staff and you realize the efforts they're putting in and understanding how much they value what they do for the people they do it for, it is ordinary people doing extraordinary things, not just for the patient, but for the family.
What I find most rewarding about being a hospice doc is helping people feel better. So my hope for the future is that we keep improving that access to hospice and those earlier referrals so that we can get people onto service earlier and make them more comfortable faster.